We are from the group The Think Tank. We are here to present in front of you about the gross anatomy of stomach. So this is the cadaver, and we will see where the stomach is located, and about the general external and internal features. The greater omentum has been removed. As we reach the greater omentum above, we will reach the greater curvature of stomach, and we will here remove the stomach from the abdominal cavity of the cadaver. So this is the stomach. It is located in the epigastrium region, left hypochondrium, and a little bit in the umbilical region of the abdomen. The external features of stomach. As the stomach lies in the abdominal cavity in this position, about this position. So here it is the cardiac opening of the stomach, and here is the pyloric opening. How we can differentiate between the two? Because the cardiac opening is a bit softer, as it is not an anatomical sphincter, so there is no circular ring of muscles present here. But the pyloric opening is an anatomical sphincter, so you feel a little bit hardness here. If you can touch, you can feel hardness or thickness of muscles here. This is a pyloric, and this is the cardiac opening. As esophagus is attached to this portion in such a way that there is forming a notch here between the left border of the esophagus and this fundy portion of the stomach. This notch is known as cardiac notch. If we draw a perpendicular line to the greater curvature of the stomach from this notch, this will divide the stomach into a smaller upper portion and a bigger lower portion. The upper portion will now called as the fundus of stomach, and the lower portion is the body of stomach. The body will end at another line that we can imaginarily drawn from another angle. The lesser curvature and the pyloric portion forms a smaller acute angle here. This angle is known as incisura angularis, and when we draw an imaginary line perpendicularly from here up to the greater curvature, now the extent of the body of stomach ends here. And the remaining portion till duodenum is known as the pyloric portion of the stomach. It has further two parts, pyloric antrum and pyloric canal, which has been cutted here. Okay, now there are two curvatures. As we already know, this is the lesser curvature, which is, you can see it is lesser in length, and this is the greater curvature, which has a huge curvature. Okay, now lesser curvature has attachment to the smaller or lesser omentum, and the greater curvature has an attachment to the greater omentum, which we have already know that we have removed or cut it a little bit portion we can see here. Or the lesser omentum contains a ligament joining the liver with the stomach, which is known as the gastrohepatic ligament. Or the greater curvature in its upward portion, the peritoneal folds merge to form two ligaments, gastrosplenic, which from here connects the stomach with the spleen, and gastrophrenic, which connects the stomach to the diaphragm, the left lobe of diaphragm, which is just above this fundus part of stomach. We place the stomach in its position, so we can see that this is the anterior surface of stomach and this is the posterior surface of stomach. ठीक है, अगर हम इसको इसकी anatomical position में पकड़ें तो this is anterior and this is posterior. So these are the two surfaces of stomach. This faces the greater sac and this faces the lesser sac. As we know that the lesser sac is present behind the stomach. अच्छा, surfaces भी हो गई, curvatures भी हो गए. Talk about the internal features of stomach. We know that in the GIT the lining has almost 4 layers: the epithelium, the mucosa, submucosa, muscularis externa, and then the serosa or the adventitia. ठीक है, serosa or adventitia, this is the visceral layer of peritoneum that is sticking to the stomach. We cannot separate it from the stomach. While you can see the mucosa of the stomach, it has some folds. These folds you can see here. These folds are known as rugae. Okay, and you can see the thickening of stomach. Stomach has a thickened muscularis mucosa. As we know, the other parts of GIT has 2 muscle layers, while the stomach has 3. So you can see the thickness of the stomach by touching it, by feeling its substance. Okay, pyloric sphincter, it is closed. It can be clearly seen here. Now we will talk about the blood supply of stomach. So as we know that the stomach is part of foregut, so it is mainly supplied by the celiac trunk, which is the first branch from the abdominal aorta. Celiac trunk arises from here at the level of between the T12 and L1 vertebrae. So here from the celiac trunk arises. Celiac trunk gives many branches. 3 main branches: splenic artery, which is the largest branch, then the common hepatic artery, and left gastric artery. These 3 arteries are the main branches of celiac trunk. The splenic artery will go above. You can see here the head and the body of pancreas. Splenic artery will go along the head of pancreas at the superior surface, head and body of pancreas, and it will go up to spleen. Before entering into spleen, it gives a branch. Beneath the stomach, it gives a branch which curves and then supplies the greater curvature of stomach in this manner through different branches. Okay. Now another branch which comes from the lower portion of greater curvature, which is known as the right gastromental artery. This is left gastromental artery, which is coming from the splenic artery. Right gastromental artery comes from another branch of celiac trunk, which is the common hepatic artery. Common hepatic artery is supplying the liver. It gives a branch before giving blood supply to the liver. It gives another branch which is known as right gastromental artery. It comes beneath the stomach from here पाइलोरिक पोर्शन के पीछे से गुजरेगी और यहाँ पर कर्व करके इसके ग्रेटर कर्वेचर के अलॉन्ग इधर ट्रेवल करेगी और यहाँ पर लेफ्ट और राइट गैस्ट्रोमेटल आर्टरीज इलास्टोमोस कर जाएंगे. दिस इज द ब्लड सप्लाई ऑफ ग्रेटर कर्वेचर. नाउ वी कम टू द लेसर कर्वेचर. नाउ वी नो दैट another branch of celiac trunk is the left gastric artery. The left gastric artery will arise from here. Like if I put it here, the left gastric artery will appear here. It moves a little upward and then along the curve towards it comes to the along the lesser curvature of stomach, and now it supplies the lesser curvature and the body of stomach through different branches. Then another branch from the common hepatic artery we have talked earlier about. Another branch comes which is known as the right gastric artery. It travels along the lesser curvature from the lower part, and then they both anastomose with each other and supplies the pyloric and the body of stomach through different branches. Some small gastric arteries can also supply the stomach through different adjacent branches, supplying the pancreas and supplying the spleen to the stomach.